नमस्कार साथियों, मैं डॉक्टर लोकेश भाटिया स्वागत करता हूं आपका लोक टॉक्स चैनल पर। साथियों, आज के वीडियो में चर्चा करूंगा एक बैक पेन प्लेलिस्ट में एक और एडिशन करने जा रहा हूं, और वो है क्या वो सिम्टम्स है जिसके कारण हम वो विचार करते हैं उस डायग्नोसिस का, और क्लिनिकली मतलब हिस्ट्री और मेनली हिस्ट्री से ही उसका डायग्नोसिस बनाया जा सकता है। बहुत सी बार बैक पेन वाले पेशेंट्स को क्लियरिटी नहीं होती है, तो मैं आज के इस वीडियो में ये क्लियर करना चाहता हूं कि अपने को हिस्ट्री कितना इंपॉर्टेंस रखती है, आप कितना मेटिकुलसली आप हिस्ट्री देंगे, उससे मेजॉरिटी टाइम्स बैक पेन में हम डायग्नोसिस बना सकते हैं। तो साथियों, आइए जानते हैं, समझते हैं। आज की जिस एंटिटी की मैं बात कर रहा हूं वो है लंबर कैनाल स्टेनोसिस और लंबर स्पाइनल स्टेनोसिस। और जब कभी बटक्स में पेन हो, let me show you on this model, जब कभी बटक्स में पेन हो या पेन रेडिएटिंग डाउन और लेग में जकड़न सी आ जाए, when you start walking and if you find a lot of stiffness in the leg, and this walking distance may vary. The walking distance, maybe 6 months back it was 2 kilometers, then 3 months back it became 1 kilometer, and now one is not able to walk even 500 meters. Whenever one attempts to walk, starts getting pain in the buttocks, starts getting pain in the thigh, starts getting pain in the leg, and the leg becomes so stiff, stony hard, that one is not able to walk, and one sits, gets relief, and when again starts walking, after some distance again one has to sit. Now this is a classical history of a patient which is called as neurogenic claudication, and no imaging studies are required. Many times it is also stated in the studies that almost 15 to 20% of cases diagnosed on the imaging studies having lumbar canal stenosis may not be having symptoms of lumbar canal stenosis. So if one is having symptoms of lumbar canal stenosis, or what I described just now, what we call it in medical terms, neurogenic claudication is there, then one should consider that this is a diagnosis. Otherwise, very likely that no other investigation may not help. So one should be very clear with the time period, the duration, the distance what with one can walk, how much distance you were able to walk 1 year ago, how much you were able to walk 6 months back, how much you are able to walk 2 months back, how much you are able to walk now. Another important point is the location of pain. You should be very clear about the location of pain, where exactly you are getting and what kind of pain you are having. So these are very important relevant points, and the history in itself clinches the diagnosis. There is no other great, neither clinical examination is greatly needed nor imaging studies will help. The clinical diagnosis is made in this particular entity, which is called lumbar canal stenosis. Alright, I have been discussing before acute lumbago, I have discussed with discogenic pain, and this is the third most important entity what I am discussing today, which is called lumbar canal stenosis. Right? Lumbar canal stenosis, the stenosis can be the canal diameter can get reduced, and if it is less than 10 millimeters on the scanning studies, on MRI if it reveals it is less than 10 millimeters, then it becomes more significant. Associated with neurogenic claudication history and reduction of the diameter on the imaging studies is very likely such candidates. Like recently only, very recently I had one patient who MRI was done, but the canal diameters were, of course it was indicative of the full history, and the clinical examination and everything was suggestive of prolapse intervertebral disc. Of course there was a prolapse intervertebral disc in the MRI report, but the canal diameters were equally important. And then when we found that there were 3 levels where the canal diameters were less than 5 millimeters. So ideally it is needed 10 millimeters plus, not less than 4 or 5 millimeters. If it is so, this is a very strong likely candidate who is going to land up with surgery. What kind of surgery, what procedure, a lot depends on the clinical examination now. If there is any weakness, then there's such pain, or if there is any progressive weakness, then such patient should be considered for surgery at much earlier time. Yes, one more important point is that the patient tends to bend forwards to be able to walk well. If you ask such a patient to bend backwards, such patient will not be able to bend backwards. Bending backwards increases the pain and brings about the symptoms in the buttocks and thighs and leg. So they cannot extend their spine. They cannot go back like this one, this position. They cannot do this. Okay. So but they will be bending forwards all the time. Okay. Whenever they are going for shopping, they will prefer to handle the trolley so that they can lean little forwards and walk more comfortably. Alright, so this was all in this video about spinal canal stenosis. This is very important entity, and this is more common only after 50 years of age. As I've discussed in my previous videos on the disc problems, that 16 to 50 years is the age for disc problems. After 50 years, one must consider this particular entity, that is lumbar canal stenosis, and the diagnosis gets clinched out by proper history taking and clinical examination, and the most importantly, the imaging studies to help us to get the diameters, whether it's a bony stenosis or a soft tissue stenosis, and most likely such candidates are more for going towards surgical indication. Alright, thank you very much. Bye bye. All the best.